You know the routine: the cold swab, the tight band around your arm, that little pinch. And it's all over in just a few seconds. But what if I told you that simple, everyday blood draw is actually one of the most high-stakes procedures in all of medicine? Seriously, a single millimeter can be the difference between a life-saving diagnosis and a life-altering injury. So today, we're going to pull back the curtain and break down the hidden science of the perfect blood draw. Yeah, we tend to think of it as just a simple poke, but for a phlebotomist, it's a high-stakes procedure. Every single time. Because you know what? It's not just about finding a vein, it's about protecting you, the patient, and making absolutely sure that the sample is pure enough to give doctors the answers they need. So that leads to the question, right? How hard can it possibly be? The answer is incredibly hard. This is a game of millimeters and seconds, where even a tiny mistake can have massive consequences. And when things go wrong, the stakes are just terrifyingly high. An incorrect test result, that could lead to a totally wrong diagnosis. A tiny slip of the hand could mean permanent nerve damage. A misplaced needle might nick an artery and not mean severe bleeding. And a contaminated sample, well, it just gets thrown out, delaying critical treatment when every single second counts. In this world, precision isn't just a nice to have, it's everything. You see, a successful draw begins way before the needle even comes out of the package. It all starts with a meticulous blueprint, a series of steps that are completely non-negotiable and set the stage for a perfect outcome. And the absolute cornerstone of that blueprint? Identifying the patient. Every single time, without fail, the phlebotomist has to use at least 2 identifiers. That's why they ask you to state your full name and your date of birth. If a patient in a hospital doesn't have an armband, the procedure just stops, period. There are no exceptions. It is the single most important safety check in the entire process. Next up, the toolkit. Every single item you see here is absolutely essential, from the sterile needles and the tourniquet to these color-coded tubes. And listen, those colors are not just for decoration. Each color contains a very specific additive, a chemical that prepares the blood for a certain type of test. So if you get the color wrong, you get the test wrong. It's that simple. All right, now for the main event, finding the perfect vein. This is really where science meets art. A great phlebotomist is kind of like a cartographer, mentally mapping out that complex network of veins in your arm to find the absolute safest and most reliable route. So this image shows us the 3 main targets right in the bend of your arm, what's known as the antecubital fossa. You've got the median cubital, the cephalic, and the basilic veins. But, and this is a huge but, they are absolutely not created equal, not even close. In fact, there is a very strict, non-negotiable hierarchy. The median cubital vein is the holy grail. It's the top choice because it's big, it's close to the surface, and it's well anchored, which means it's less likely to roll away from the needle. The cephalic vein is a solid plan B, but that basilic vein, that's the one you only go for when you have absolutely no other choice. And this quote right here tells you exactly why. The basilic vein is nestled dangerously close to a major artery and major nerves. A miss here isn't just a miss. It's a potential disaster that can cause severe pain and even permanent damage. And that's exactly why it is the vein of last resort. And beyond just choosing the right vein, there are entire areas that are complete no-go zones. An arm on the same side as a mastectomy? Off limits. An arm that has an IV running? Absolutely not. The IV fluid would totally contaminate the sample. And any area with scars, bruises, or swelling is also a definite no-draw zone. Okay, so we've identified the patient, we've got our gear, and we've found our vein. Now for what might be the most technical part of this whole thing, the order of draw. This is an unbreakable sequence, and it's designed to protect the integrity of the blood sample itself. The entire reason for this strict order is to prevent one thing: cross-contamination. Remember those additives in the color-coded tubes? Well, if even a microscopic amount from one tube backwashes into the needle and gets into the next tube, it can completely corrupt the test results and could lead to a completely false diagnosis. But before we even get to the order of the tubes, there is a ticking clock. That tourniquet can only be on your arm for a maximum of 1 minute. Any longer than that, and you risk something called hemoconcentration. That's a state where the blood gets too concentrated, and it can artificially inflate results for things like cholesterol and protein. So this is it, the unbreakable order. You always start with sterile blood cultures because they have to be absolutely pristine. Then you move to coagulation tubes, which are extremely sensitive to any kind of additive.
After that comes the non-additive tube. It's only at the very end that you draw the tubes that have all the different additives. This exact sequence makes sure the additives from the later tubes can't possibly mess up the earlier, more sensitive samples. Okay, the blood is finally in the tube, but the job is not done. The final phase is all about what happens after the draw, handling the sample correctly to prevent any errors that could make the entire procedure totally useless. So we've already talked about hemoconcentration. Another huge error is something called hemolysis. This is basically the bursting of red blood cells, and it can be caused by something as simple as not letting the alcohol dry on the skin before the poke, or by shaking the tubes instead of gently inverting them. And just like that, poof, the test results are completely worthless. And then there's the complication we've probably all seen or had before, the hematoma. It's really just a fancy word for a bruise, and it happens when blood leaks from that punctured vein into the tissue around it. The good news is most of these bruises are totally preventable with good technique. Things like puncturing only the top wall of the vein, making sure the needle is all the way in, and applying firm pressure after. But here's the big one. Always, always, always remove the tourniquet before the needle comes out. So from patient ID to mapping the perfect vein, from the order of draw to preventing a simple bruise, the perfect blood draw really is a symphony of critical decisions. So the next time you find yourself in that chair with your arm extended, what part of this hidden high-stakes ballet will you appreciate the most?